The things I value most about being a NACHC member are probably from an organizational level as well as personal. From an organizational level, NACHC has brought together so many different things such as policy, frontline operations, finance, and giving us the tools we really need on the front lines, as well as being in Washington, D.C. and other areas in the state to help us with the issues that affect our patients on a daily basis. On an individual level, NACHC has been kind of the tool and the mechanism for me to develop personally. My leadership skills as a clinician, I get to rub shoulders with colleagues that are on the front lines of HIV/AIDS treatment, of colorectal cancer screening, and moving forward with the American Cancer Society. So I really value what I get from NACHC, both as an organization, but also individually. I joined NACHC in the first place because my CEO was very involved, and he thought it was very important for me as a clinical leader to come to the NACHC meetings to find out what was going on in other parts of the country and to develop me as a leader. I got involved probably about 12 years ago, and it's a very interesting story. I started off working in a community migrant health center in rural California, a town of about 7,500 people, and I thought I would just see patients the rest of my life. Well, before I knew it, I was coming to Washington, D.C. and meeting people and ended up on the clinical practice committee. Well, from there I got more involved and ended up chairing the committee. Then I was asked if I was interested to be a board member. So I became a board member. From there, they developed me further, and I actually ended up on the executive team as a treasurer. And through all of that time, my leadership skills were developed. I learned how to speak better, how to communicate, how to talk to officials, such as the Secretary of Health and Human Services or the HRSA director, Mary Wakefield. And so what that did was really help to bring out some qualities in me that I really didn't know were there. So NACHC has kind of nurtured me and helped me to realize some things in my life and to know that on the front lines I can make an impact for our patients on a national level rather than just seeing one patient at a time, which is important. I'm able to come to DC and do other things to really impact policy and things on a larger level so that our patients are supported in a greater way and nationally. You know, things that have impacted our health center through the NACHC trainings have been on a large and a specific scale. On a large scale, coming and hearing about the patient-centered medical home, about accreditation, those things are things that we bring back to our health center and really apply so that we can kind of have a head start on things like implementing patient-centered medical home, electronic health records. So those are the big picture things. On an individual level, I just came from a seminar on Federal Tort Claims Act and malpractice. And even after attending these sessions probably a dozen years in a row, I learned more new things. So I actually took notes. I'm going back tomorrow and I'm going to implement these specifics about contracting, things that I need to include for credentialing and privileging. So there's things that are big picture as well as the detail things that we continue to learn every time I come to a NACHC training, to the CHI, the Community Health Institute, or the Policies and Issues Forum in Washington, D.C. Being a speaker at some of the NACHC sessions is kind of a real highlight for me. As a clinician, you know that you kind of have to see one, do one, and teach one. And so it really drives home a lot of the things that I need to learn and understand myself. So I enjoy it because I continue to learn. And so when I get questions from the field or from participants, it stretches me. It makes me go back and research things, and I try to stay on top of things. And if I don't know, I admit it, and I'm able to go and find out. So it develops me personally, but also helps me to keep on top of things and at the top of the game for our health center and for our patients on a national level. So not only do I learn things and continue to grow, but I meet some great colleagues along the way, co-presenters, people that come up afterwards that we talk to. It's just a great network and a family, and really a collegial camaraderie that is developed through the years. I enjoy working with the NACHC staff, including the Clinical Affairs Division, through the years. And the thing that really has amazed me is these people are really bright people, okay? Well-educated, bright people, but they're also the nicest people. There's no arrogance involved. They're very down home. They love patient care. Even being in Washington, D.C. and working at a higher level, they still have that flavor of really caring about patients. And that comes through everything they do. And they're so focused and dedicated and mission driven. So I really appreciate that about the NACHC staff because they carry that through at a higher level that we experience on the front lines, taking care of patients one at a time. NACHC has really helped develop me as an advocate for health centers because they've trained us and taught us about what it means to go to Congress. I've loved to have the combination when our board members come with my CEO, when we go to Washington, D.C. every March for the Policies and Issues Forum. It's a great combination of having our board members, who sometimes are my patients, come with us to go and talk to the congressional members. And NACHC is so good at summarizing things. We have a one-page that we know what the talking points are, we know what the issues are, and they know how to really consolidate what needs to be communicated to members of Congress. So when we go, we know exactly what we need to say, and when you combine patients and a clinician with the issues and data, that is a very strong message to Congress. And I think that's why NACHC and the Community Health Center program has been so successful through the years.